In this presentation, we discuss the importance of flat and depressed colonic lesions and illustrate both types of lesions with endoscopic videos. A majority of colorectal carcinomas arise from polypoid adenomas. Up to a third of colorectal carcinomas may be arising from non-polypoid lesions, also known as flat and depressed lesions. Though initially thought to be a problem mainly in Japan, recent studies from the United Kingdom, Sweden, and the US have demonstrated their importance in the Western world. A flat lesion is defined as one in which the height of the lesion is less than half of the lesion's diameter. A depressed lesion is characterized by a base which is below the level of the surrounding normal epithelium. Though originally classified into superficial elevated, flat and depressed lesions, colloquially, flat and superficial elevated lesions have been referred to combinedly as flat lesions. Flat and depressed lesions are difficult to detect both by colonoscopy as well as CT colonography. These lesions might be contributing to the pool of missed lesions which lead to interval cancer, which occurs at a rate of 0.3 to 0.9%. These lesions have a high likelihood of having severe dysplasia as well as invasive carcinoma. A recent study showed that these lesions are 5 times more likely than polypoid lesions to have in situ or invasive carcinoma, and among them, depressed lesions have the highest risk. The following video demonstrates a flat colonic lesion. Notice how this lesion is obscured by a colonic fold. Using a probe to move the colonic fold helps visualize the lesion better. The lesion is characterized by an irregular surface, the altered vascularity, and easy friability demonstrated with the probe. Notice the bleeding which occurs on probing the lesion. Instilling indigo carmine dye helps appreciate the mucosal abnormalities better. The following video demonstrates a depressed colonic lesion. This patient had previously undergone 3 yearly colonoscopies with poor preparation in the right side of the colon. Note that the base of the lesion lies below the level of the surrounding mucosa. Notice the characteristic irregular lining and the altered vascular pattern. Again, these details are much better appreciated after instilling indigo carmine. In summary, flat and depressed lesions have a high risk of neoplasia and are likely to be missed. Good bowel prep and high vigilance are needed to identify these lesions.